After receiving the instrument, install it first. We used cross screws to fix it. On the left side of the fixed bracket, the left side of the instrument is the cutter head, and the right side is our gun head and activation head. It's the same here. There are 2 cross screws to fix it. Then behind the instrument, there is also a body head, which is fixed with cross screws. After fixing, put them in the brackets in sequence. After putting it in the bracket, we go to the second step. We need to add water. To add water, remove this plug. After removing it, use a funnel. There is a funnel in our instrument. Connect the funnel to add water until water flows out from this mouth. Add water from here. Until water flows out of this opening. You can put a small basin or a bowl below. After it flows out, we unplug it here. Pull it out and put the stopper back in. After inserting it back, we installed the handle. This is for adding water. We installed the handle. Install the handle in order. Each interface, its grooves and protrusions, including the hole type, align the groove with the protrusion below. Align the two holes and insert it tightly. Tighten it. Then this is our knife head. When we pull out the blade, let's take a look. We pull it from this position. When we install it, there are 2 arrows. With the arrow pointing up, there is a protrusion here. Align the bump with the groove. Then insert it. When you hear a click, it's okay to insert it. This is our body head. The body head also has an arrow here. Align the arrow with the triangle arrow. Then insert them in turn. Then this one, look. This is a 3-hole heart. Align the 3-hole heart with the 3-hole heart. And the same goes for this side. To pull it out, pinch here and pull it out. When installing, pinch it here, and the arrow points directly up. And insert it. After insertion, you will hear a click. Then the power cord should be fully plugged in. Then we turned on the power switch. Then we installed it. Just insert it. Just heard a click. Don't turn it left and right. And this one is not a left and right knob either. We can only turn this one. The metal cap outside can be rotated, but not the other heads. Plug in the power. After turning on the power switch, press the button in front to turn it on. Turn on. Then we will enter such an interface. Then the handle. It will connect. And there will be a sound. Then we click on the interface to enter. After entering, we can select our probe from here. The first one is our knife head. This is our gun head. We can see it from here. This is our activation head. This is the eye. And this is the face. But when we replace the probe, we need to replace it from here. You can't just pull it out. It's not a knob. Then you can see that there are 3 hearts. Align the 3 hearts. Then insert it. This is the activation head that needs to be replaced. We also need to replace the knife head. Our handle. When replacing, we press the 2 buttons here and pull it up. There is an arrow indicating here when we installed it. Align it with the arrow and insert it. If you hear a click, it is a normal output. Okay, this is our body head. There are 4 different handles in total. Let's talk about the parameters of interface adjustment. Now, first, the interface adjustment of the knife head here, which shows the depth of 4.5. This side is the number of strokes. This is the number of times it has been used. And here is the interval. The interval is usually 1.5. 1.4 to 1.5. Then here is the intensity of energy. We usually start from 2 for energy intensity, and we can adjust it according to customer tolerance. This is the length. Length 25, which doesn't need to be adjusted. We mainly adjust the energy and adjust the density. This is the time. The default time is 30 minutes. Then here are start and pause buttons. This shows the number of shots we have used this time. It will automatically reset when you return. Let's take a look at the interface of the gun head. When adjusting the probe, it shows the number of shots we have left. This is the number of shots already used, and here is the depth. We don't need to replace the probe for the gun head. It's from 1.5 to 4.5 meters, which can be adjusted. We can also make private customization for customers. The depth we commonly use is 2.0, which is commonly used. This is the intensity. We start from 2 for the intensity. Adjust it according to customer tolerance. If the customer thinks 2 is unacceptable, it can be lowered. This is the frequency, which represents the speed of tapping. This is used in conjunction with the pedals. The speed of markings is generally round 3 to 5. We can adjust it according to the speed of our operation. Then here is start and pause. We don't need to adjust the time. Then comes the third activation. For activation, we only need to adjust the intensity of energy. It also starts from 2. When we use the activation head, we usually use it with cream products. Then here is start and pause. Then to the body head. The body head also needs to be used with a foot pedal. This is the remaining hair bundle. This is the hair bundle that has been used. This is the depth. Depth can be adjusted from 8 to 13. We start from the deepest depths of 13.0 and then gradually cut down to operate for customers. This is the intensity. The intensity usually starts from 2 and adjusted according to the customer's tolerance. Then here is the frequency. The speed of dotting is about 3 to 5. Then here is start and pause. This is our interface adjustment. Now we are practicing the practical operation method. We start with the activation head and click the activation handle. Adjust the intensity and start. After wrapping the model's hair and clean the face. After cleaning, we apply massage cream. Let's operate one side of the face first. Let's demonstrate the practical operation. This hand can slightly lift the temples. Then, with the probe, use the probe to spread the product evenly. After spreading evenly, we started to lift the skin in circles upwards. Then slide. Slide up with force and stick to the skin. Lift up one line at a time and overlap 2/3 of each line. Pull up one line at a time until you reach the position of the eye socket bone. Then we go back to operating. The probe must be completely attached to the skin and cannot be loosely attached or cannot be suspended. We can't stay in this position or operate in a suspended manner. The probe must be completely attached to the skin. The probe must slide and keep changing the position. Don't stay in one place. Then for one side of the face for about 3 to 5 minutes. Use the same technique to operate back and forth. This area can be lifted up. Pull up with force and stick to the skin. Okay, then to the temples. Lift it up in the same way. Pull it up with force and then back. Then to the forehead. For the forehead, spread the product evenly first. After spreading evenly, draw an M and slide back and forth. After 3 to 5 minutes, we pause the interface. Let's demonstrate the eye and head operation. Adjust the interface strength to the activated level. Start from 2 o'clock. This is the probe for the eyes and head. Apply the product to the eyes. After applying the product, draw small circles. The probe also has 2 points. It must touch the skin. And don't stay. We also need to keep changing the position. When reaching the temples, you can slide it When sliding, use force on the upper body. This hand can be used to soothe. Then slide back and forth. Pull it over and stick it back with force. Then make small circles. And repeat these 2 actions to operate. Okay, then on the upper part, Jingming point can be lifted to the brow bone. This hand can be used to soothe when reaching the eyebrow bone. Then we can pick it up when operating, but the probe can be loosely attached. Okay, then lift it up from the outer corner of the eye. This hand to soothing. Then lift it up from the eyebrow bones and above the eyebrows. And the other hand to soothing. When we use the activation head, there is a button that does not need to be pressed. We can directly start on the interface. The same goes for the facial head. This is the usage of eye activation. After we finish, pause. After we use the activation head, we need to wipe off the facial massage cream. When we use the activation head, we should use it with cream products. Later, we will use a 4.5 knife head, ultrasound, and the knife head is used with the bubble head, and body head with gel coupling agent. So, let's wipe off the massage cream completely first. After wiping it clean, replace it with gel. Now we operate the knife head to apply the gel. Use a mask stick to apply the gel. Apply it to the thickness of a coin. It doesn't matter if you apply more gel. Now we are using our knife heads. Depth of 4.5. We also use the depth of 4.5 first. Then adjust to 1.5. Energy level 2 or 3. Length 25. Click Don't Start. Move. After starting, use the probe to spread the gel evenly. Or use a mask stick to spread it evenly. After spreading evenly, you can lift your hand to the temple or hold the probe with your hand. The model can slightly turn her head to this position. Lift it up a little bit from the jawbone and hit the first shot. When you press the handle button, release it. Don't hold it down. And then the second shot. Move up 1 to 2 millimeters and fire the second shot. Then don't release the pressure. Each shot should be without releasing the pressure. Move up slowly to pile up the meat. And ends at the position of the nose wings. Then spread the gel evenly. After spreading it evenly, the second row is about 1 centimeter away from the first row. The first row is in this position. The first row is in this position. Then lift it up from the jawline and hit the bone. The second row is the same operation. Lift it up. And ends at the bone of the apple muscle. Then the third row is about 1 centimeter behind. Overlapping 2/3 of the previous row. For operation, our probe needs to be close to the skin. We can see that the probe needs to be fully attached to the skin. Don't do it like this. Or do it like this. It must be completely attached to the skin. Don't hit it in the air like this. It must be completely close to the skin. Don't lift it up like this. It can't be lifted up front and back. Now we are doing the fourth row. When operating, we can't keep the probe in one position. Repeat the output. After finishing one shot, we wait until the light doesn't flash anymore. Lift it up a little bit. When the flash occurs, we don't move the probe. Okay, lift it to the apple muzzle. Finished. This is the first time. Then we come back and start from the first line to do the second time. And then back and forth. We did it 3 times in total. Then the second line. The third line. When we operate, we must follow the customer's feelings within the range that the customer can accept to adjust the intensity of the energy. When operating, if the customer has had teeth treated or have cavities, their teeth may be more sensitive. You can use a cotton pad to wet and wring out the saline and insert it between the teeth and the mouth. Okay, let's repeat it for the third time and finish. After that, we'll start to walk the double chin. Let me directly demonstrate the method of double chin. For double chin, we do the same. Spread the gel thicker. The thickness and apply more gel. Then ask the client to cooperate. You lift your chin up. Lift it up a little bit down from the middle of the bone. Fire the first shot. Then go down a little bit for the second shot and a little bit lower for the third shot. Then you can come back. Downwards. A total of 3 shots. It's also 3 shots when going down. You can come back and shoot 3 more shots. Our probe must not be tilted like this. It must be completely attached to the skin. Then go to the second row. For the second row, we walked along the sidelines below the bone. Don't get stuck on the bone. The force of the operation should be slightly heavier. Then move back about 1 centimeter. Fire 3 shots downwards. After 3 shots, move to the next row. We'll do about 4 rows of double chin. 3 in the middle. 1 row in the middle. 3 rows on the side. And repeat it 3 times in total. Go through the process again and again. Then we must pay attention to the operation. Many people's bones have a corner. We must not get stuck at the bone position. You can probe in front of the bone or behind the bone. Don't get stuck in this position on the bone. Otherwise, the customer may feel uncomfortable. Then go the third time. We walked 3 times in a loop. After walking the double chin 3 times, we go to the sideline. For the sidelines, we target the corners of the mouth. Many people have corner bags. We lift it up. This hand can assist. To lift the neck. And lift it up one by one. Don't let go, and lift the meat up. Okay, that's the end. The whole line we walk starts from this place and ends here. Lift the outline of the side lines upwards. And for the second line, we start from the nasolabial folds, from the corners of the mouth. Our probe is in this position, pulling up from the corners of the mouth to the position of the nose wings. Then start again and move a little bit towards this side. Then you can use your fingers to press to assist the instrument. Then end here. There are 2 rows in total. Now let's start the second time. and it will be repeated 3 times in total. Okay, after 3 times. For some people, the contour line here, and more fat here. We can use the probe to lift it up. Lift it up to the apple muscle area. Let me demonstrate it. Pull it up. After lifting it up, it should avoid the area 1 finger in front of the ear. Okay, this is our 4.5 operation. Now we change to 3.0. When we change the probe, you can press the button with 2 fingers and press up. Because the arrow indicates up, then we take the probe up. When we installed it, the same interface, align it with the interface, and then insert it to hear the sound. After the sound stops, we click Start on the interface. Because we have already adjusted the interface of 4.5, we don't need to adjust 3.0. Now we are installing a 3.0 probe, and then click Start directly. Okay, now we're using the 3.0 probe, which reaches the dermis. It would be shallower than the 4.5 we just walked. The direction is the same. It's also lifted from the jawline. And push it up 1 by 1. And push it to the nose wings. For the operation, for thin people, is also completely attached to the skin. It can't be lifted up like this. Then the second row is about 1 centimeter which is back. About this position of the first row. The second row is about 1 centimeter behind. Then the third row is about 1 centimeter back. Okay, after that, we'll start all over again. Start the same way. And walked back and forth 3 times. After walking 3 times, do double chin. Let's apply more gel to the chin. If it's too thin, add more gel. We must pay attention during the operation. Keep the gel at the thickness of a coin. The gel can't be too little. Now the model can lift the chin a little bit. Yes, including us. Let the customer cooperate to lift the chin. It's the same as the direction of 4.5. The thick part in the middle can be back and forth. To walk back and forth like this. Then tilt it a little bit. Yes. Walk the side line. We did it 3 times in a loop. After walking 3 times, we walk the outline side line. For the sidelines, we do the same thing. Lift up the corner pouch of the mouth. Because of our mouth corners, has lines that go down like this. So when we go down, we need to lift up the flesh. Then click Start. Okay, the second line. We look at this probe. Start from the corner of the mouth to the nose wing. And start from below the apple muscle. Don't go over the apple muscles. And go back and forth in the same way. Then come back and go from here. And ends at this place. Repeat the 2 lines 3 times. After 3 times, enhance the outline. For the outline line here, we lift it up. Until the apple muscles. Also go back and forth 3 times. After that, we change to the third probe. When we replace the probe, we need to pause the interface first. Then we can pull out the probe to replace it. You can't directly pull out the probe on the start interface to replace the probe. Now we operate the probe. The depth of the probe is. We usually use a depth of 2 millimeters and adjust the intensity to 2 or 3. And here is the speed of punching points. You can start with 3 and then adjust to 4 after proficiency. If you are not skilled at first, this probe is used with the foot pedal. First, stick the probe to the skin, then step on the pedal. Let's start the operation. Okay, release the pedal first. Then remove the probe. Each line is overlapped by 2/3. Move at a constant speed. The probe cannot be paused during the operation. It must be completely close to the skin. Move slowly. Follow its curvature. Our contour. Follow the curvature of his contour. Turn your wrists. Okay, the last line. From the tip of the nose to the end of the eye. From the apple muscle to the end of the eye. Well, these lines are for the face. We want the face 3 times in a circular way. Second time for the lower part. Okay, we'll finish walking the entire face. After that, we strengthen the double chin. Let's take a look. Stick close and lift your feet. Then we caw. We can walk back and forth. You can step on the pedal back. 3 back and forth is enough. Okay, then lift it up until the apple muscle area. And then stop. Now let's demonstrate the technique for the eyes and forehead. When we work on the eyes, from the nose wings, from this place, lift up the position of the nasal base. Then step on the pedal to start to the end of the eye. Then in the middle, to the end of the eye. Then from the orbital bone to the end of the eye. There are 3 lines in total. And repeat it 3 times. The probe must be completely attached to the skin. Then you see that our wrists have an arc. You must turn it downwards and turn it to follow it. Okay, and from the end of the eye, as you can see, lift up the outer corner of the eye a little and lift it up to the brow bone. This movement is for the crow's feet. We lift it up. After 3 times, move to the forehead, from the eyebrows to the hairline on the forehead. Each line is overlapped by 2/3. And go 3 to 4 lines in total. End it at the end of the eyebrow. Draw a straight line and lift it up. For the forehead, we also do it back and forth 3 times. After 3 times, it's done. After that, scrape off the gel. Sit up and see the effect. Next, we operate the body and head. We can adjust its depth from the interface. We start with the deepest layer at 13.0. And this is the intensity of our energy. The handle shows 25%, and the interface shows 0.5 intensity. Click the handle. You can also start or pause directly. We operate it by stepping on the pedal. When operating, we stick the probe to the skin first. After sticking it, step on the pedal from the waist to lift it up. Lift it up and release. Avoid the navel and the bone. We operate the same way. Step on the pedal again from here and lift it up to the upper part of the navel. Then lift it up from the same starting point. Each line overlaps 2/3. To lift up. When we operate, you can see that we avoid the bone position. The last line passes by the bone. And stop at the stomach. Okay. Then go from the same position below the navel. Each line overlaps by 2/3. And do it back and forth. Do it 5 to 8 times. When operating, the probe should be the same. Don't stay and don't stick and loosely. Cannot be suspended. If there is no gel, apply a thicker layer of gel. When operating, the probe should be slightly close to the skin and lift it up with a little force. After we finished 5 to 8 times, we can adjust the depth to 10.0 or adjust it from the interface. After setting it to 10, then we step on the pedal to start. The depth will be slightly shallower. Walk back and forth 5 to 8 times. And walk back and forth. After walking, we release the pedals first. Then leave the probe. After the operation, just wipe off the gel. Okay, let's talk about the usage sequence. The first step is to use the 45 depth head for deep anti-aging, which reaches the subcutaneous fascia layer. The fascia layer is for firming. We use the depth of 4.5. After using the 4.5 the second step is to use the 3.0 depth. The 3.0 depth reaches the dermis to regenerate collagen. These two heads are used for facial treatment. After that, we use the depth of 12.0 of the cannon head and use the foot pedal to do it. This is the usage sequence of our 3 heads. When using the 4.5, 3.0, and bubble heads, there is a facial operation prohibited area. Firstly, we should avoid the position of our temples, which should be strictly noted. And we should avoid operating the area in the middle is not operated. Then the vertical line from the corner of the mouth, the middle part should not be operated. Then the bone position should be avoided. Thyroid cartilage should be avoided, and the large artery behind the ear should be avoided. Do not operate one finger in front of the ear, and the decang pointed one finger away from the mouth. And the orbital bone and upper eyelid are not operated. Then the middle of the forehead and the middle part should not be operated. This is where we avoid areas with many nerves. Let's explain. After using the instrument, you must pause the interface. No matter which probe is used. After pausing the interface, press here to turn off. Turn off the power switch at the back. We unplug the socket end of the plug board and then connect the power supply of the instrument. We disinfect the instrument after each use. After each customer is done. Must be clean. We must handle the probe with care and can't be dropped.